We have seen people adjust their behaviors, and for that I'm very grateful. And I think most people are doing the right thing. We've seen transmission in parties and social events, particularly amongst young people, and we recognize that that is an important part of one's life when you're young. That need for social interaction is so much higher. So now we need to change our focus and do it in a safe way. And we've given people the tools to do that now, once we've recognized that this was a challenge. We do have some enforcement pieces, and that has helped a little bit, I think, in getting people the message. But I also want to say, it is important. It's part of us enjoying society and each other and the joy that we have in life to have social connections. But right now, in this pandemic, we have to do it in a different way. And that means we have to keep that group small, the same group of people. It's the mixing with people that we don't know, that we know is risky, because we are then subjected to the people they've been in contact with, and that risk goes up really quickly. So yes, we do need to have that social interaction, but as we're moving into the fall, we need to rethink how we're going to do that. And for a lot of young people, that means they might be going back into work, they might be working already, they might be going back to university or school. And we need to rethink what that means for us in all aspects of our life going forward.
Yeah, thank you. On slide 8, it says there are unnamed places where people contracted COVID-19, and I'm just wondering if you can explain what exactly that means.
Yeah, so sometimes we don't have all the data, so we put that in. So some of that reflects the fact that we can't link everybody, but the people that we can't link, and I've talked about this before, that I watch very carefully those unlinked cases in our communities, and we make sure that we're not seeing the start of new transmission chains, and that number remains very low. So it's under 20%, even in this phase of the pandemic. So that's mostly what's in that group. And one of the reasons we wanted to present that data today is just that. There's been a lot of high-profile discussion about private parties, particularly related to the Kelowna cluster, about bars and nightclubs here in the Lower Mainland, and some of the private events that were happening were much more high-profile, and where there was public notification because we weren't able to find everybody in a rapid way. But the work in public health, we have been focusing on workplaces, and while some of the larger outbreaks have been reported publicly in workplaces, many of the smaller ones where we are able to find everybody aren't in the public eye in the same way. So there's been calls from some people to, the answer to everything is to close down the bars and restaurants. And I wanted to put it out that there's many different settings that we are having transmission, and we are working with people in those settings to make sure that the safety plans get put in place. And this is some of the work we've been doing with WorkSafe BC and with public health inspectors going to workplaces and finding why transmission is happening. And usually it's just 2 or 3 people or maybe more within a workplace, and we can put in place those measures that protect people. So here in BC, one of the most important tools that we have is every business or organization having to have their COVID safety plan, and that's a way of making them think about what does it mean for me in my setting, in my business. And those are the things that have been helping us in deal with the transmission in those settings.